and welcome to another Coalition for Health Funding blog. My name is Tiffany Kaszuba. I'm the Deputy Director of the Coalition for Health Funding. For those of you who don't know, CHF is the largest and oldest coalition of its kind. We advocate for funding at the Department of Health and Human Services outside of the entitlement programs. One of the issues we've been following really closely this summer and now into the fall is the family separation crisis at the border. While we don't usually cover immigration policy, unaccompanied alien children, or as we prefer to call them, unaccompanied migrant children, are taken care of by the Department of Health and Human Services. During the family separation crisis, the new policies implemented by the Trump administration actually created about 2,400 extra unaccompanied alien children in the Department of Health and Human Services care. And in past administrations, there's been an emphasis on getting children out of HHS's care and either back to their parents, to their families, or to some type of an adoption service. In the current administration, there doesn't seem to be that emphasis, and there seems to be an increase in stays. Further, we're expecting new administration policies to further increase the number of children in the unaccompanied alien children program. One of the questions that the Coalition for Health Funding has had since the beginning of the family separation crisis and now going through this increase in the number of kids in HHS's care has been, where is the funding coming from to take care of these children? As appropriators did not have the information that they needed, Congress did not have the information that they needed to provide enough funding to take care of these children. We've been asking this question. We've reached out to Secretary Azar. The Secretary was in fact using his legal right of Secretary's transfers to cut about $266 million from other public health programs such as cancer research and maternal and child care to care for these unaccompanied minors. While these type of transfers have been used by past administrations to address surges in the number of kids coming over the border unaccompanied, the current situation has really been created by the administration's policies. Thus, over the last couple of weeks, we've been organizing a sign-on letter. The Coalition for Health Funding and 110 organizations signed on to a letter asking Secretary Azar to produce a comprehensive budget plan to address the unaccompanied alien children. At this point, we haven't heard back. It just went up yesterday, but we are requesting to have a meeting with him to further discuss these issues and hope to be able to have something to report back out to you in the coming days. But for now, thank you so much for listening. If you have any questions, please leave them in the comments.